Hi, my name is Vanessa Alcon Jaime, and I am the Clinical Subspecialty Manager for El Centro Regional Medical Center's Oncology, Hematology, and Infusion Center. Sure, the partnership has been nothing but miraculous for us and our patients in terms of building communication and a bridge to get these incredible offers that the CRCD provides for our patients, the opportunities that they provide and the chances that they give these patients to truly get the help that they need is essential for the progress of our patients. The patients are so agreeable to them, they're so kind to them, and vice versa, because they are really here to help our patients. Sure. Well, the groundwork pretty much begins when that patient starts seeing somebody in our clinic. We will refer them out to CRCD, and the CRCD will reach out to the patients. CRCD then comes and visits twice a week, depending on a patient's needs. If there is something that does not fit within those 2 days a week, then they come in special just for whatever particular issue that patient may be having. Most important one, I think, that I can name off the top of my head is the transportation issue. A lot of our patients have transportation and mobility issues. So patients that are homebound because of not having the correct equipment, getting to our office is very difficult for them, and that's one of the best things that CRCD provides, is just getting them a way to be transported to our clinic so that they can continue their care. Well, I think the most important thing is that it's an external help for these patients. We are pretty limited in terms of the type of help that we can provide when they're here in our clinic, and the follow-up is what's required, and that's what CRCD really helps us with. CRCD is definitely the help that helps us outside the door from here. Our clinic is an 8 to 5 Monday through Friday center, and but the assistance that needs to happen sometimes happens after hours, and CRCD is essential in helping them answer questions or provide them with additional care. I absolutely have an example of a patient who just has benefited so much from the assistance from CRCD. This patient lives alone. He's elderly, requires weekly transfusions, and has big issues with transportation and getting to our clinic, and not just that, but his follow-up care in San Diego. With the help of CRCD, this patient has been able to get rides to San Diego to his appointments, like literally dropping him off at the door, so that this patient can continue care with the providers that are required to keep this patient healthy. And the patient actually comes in every week, and he looks for his helper, and she is always here with a smile and to greet him, and she knows him personally, and they chat, and it's a beautiful thing to watch. And she knows exactly how helpful she has been to him, because if it wasn't for her providing him this service of getting this ride to San Diego, it'd be really hard for him to really overcome some of the medical issues he's been having. But thank you so much to CRCD. I mean, he has made a complete turnaround, believe it or not, and he's doing super well, and a lot of that is thanks to CRCD. The services that CRCD provides also relieves a lot of the stress that these patients go through. The stress of that patient knowing that they have an appointment in San Diego and have no way to get there. How would they figure that out? Who would they reach out to get that assistance? And this service has provided so many patients with those kinds of outlets. Outlets for things that would be logistically very difficult to accommodate, but CRCD has always come through, and with their communication and with their ability to connect with these patients has been amazing, and such a great addition to our clinic. I would like to encourage any and all available businesses and entities that are out there that can provide some support and donations for this organization, which has helped us in so many unbelievable ways. The outcomes of these patients sometimes is not good, but whatever we can do to assist them to make it just a little bit easier is essential. And having the CRCD with us is absolutely phenomenal. And any help that we can get and they can get is just helping our community and all of our patients.